So my question is, does the primary care models shift? And let me tell you how I'm thinking about this. Obviously, primary care physician is great, but it's almost like I want my primary care physician to be a telehealth provider. I want, and it could be with my local health system, but I want somebody that this week I can get on have an appointment with. Is, they're doing 10-minute appointments and they're just going Zoom, 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 and they're seeing a lot. Their panel can be larger, but they're interacting with me more. I heard Jonathan Bush, who is a part of Firefly Health, and they said the average, because they have a model similar to this, and they said the average interaction that their patients had with a physician last year was 62. And I thought, yeah, that's good. That means I'm engaged. We always said we want them to be more engaged. So part of me wants, instead of having to set up that visit, which by the way, I have to get a new primary care doctor, and it's like 2.5 months till I can get in to see the primary care doctor because they have to do a complete panel and all these other things, whatever they're going to do. And so for 2.5 months, I'm just going to wait until I can see that primary care doctor. That's a broken model to me. Seeing the telehealth doctor makes sense over that 2.5 month time frame. The other thing is you talked about AI and machine learning, but they almost become a part of that team of the virtual care provider who's triaging all my stuff, the primary care physician, and then AI is taking all that data, right? So the Internet of Things, the Internet of Health things, and it's bringing all that stuff in. So I might have Livongo devices, I might have a scale, I might have an Apple Watch, but it's bringing all that data in, and the machine is crunching that data and providing insights to either my virtual care doctor or my primary care doctor that they can communicate back to me. First of all, does that make sense? And second of all, if it makes sense, how hard is it to transition a health system to that kind of model of care?
So a couple of things I'll share is I don't think it's an either or model. I think it's an and model for sure. It's all of those things working in concert. I think we're seeing a trend where the types of interactions also include asynchronous communication as well, right? And other ways AI can be leveraged, including conversational AI, or what most people know as chatbots, those text conversations that in some cases can be automated to make it easier for the humans to pay attention to what only humans can do. So I think that's another method of engagement. Get answers about medications, get answers about side effects, get answers about the conditions that you have or the things that are impacting your wellness very easily in an automated way. But it still feels more warm and human because it's a text message. Like we all text back and forth with all of our friends, loved ones, family, coworkers all the time. So it still has that human interaction feel to it. That's another component. Email and other messaging communications. It doesn't always have to be a video visit, but incorporating all of those things together in a more holistic model. And an interesting sort of side note too is we're also seeing an expansion of the direct primary care or more dedicated models of health management that are out there, just different from the traditional system. Some of them incorporate all of these things very tightly and really are focused on that wellness picture. ChenMed is an example that a lot of people have been exposed to in terms of the way that they approach the Medicare population very directly with a very preventive mindset, but incorporating a lot of these same types of things that we've been talking about. So I do think a lot is changing, but I think the answer is not to throw out the baby with the bathwater. It's to, so to speak, it's really to incorporate all the new tools and make them part and parcel of the overall experience. There will always be things that require human interaction. And to some degree, that's much better in terms of just your general sense of well-being as well. It's hard to feel cared for example, if you're on a video meeting like we're having today, versus when there's actually that true contact in person. So it's not either or, it's and.